associate professor in the Department of Educational and Counseling Psychology and Special Education at the University of British Columbia. Previously, he served as an associate professor of psychology at Western Washington University and an assistant professor of counseling psychology at the University of Victoria. Dr. Bedi is a registered psychologist in British Columbia. His scholarly interests include international, cross-cultural, and multicultural counseling and psychotherapy, particularly with individuals of Punjabi Sikh descent. He also studies professional issues in counseling psychology in Canada and India, as well as counseling and psychotherapy with men and masculinity. Take it away.
Okay, thank you. So I come from a very extremist program or department, and it actually kind of feels wrong in a sense, metaphorically, not to give a land acknowledgement. So I'm going to break with tradition, and for fear of being fake here, I'm actually going to rely on somebody else's land acknowledgement for a second here, though. So this is my land acknowledgement. Sorry, this is my land acknowledgement for today's talk. So that's sort of tongue-in-cheek. My department starts their meetings with a land acknowledgement, and it came to my turn, and we were all told it was voluntary, and I respectfully declined, and I didn't realize that it really wasn't voluntary. I mean, there's no formal consequence you can get, but there is a sort of norm, and so if I could go back in time, I would have said yes and would have started with that clip and stuff. So if I get asked again, that's probably what I'm doing. But anyways, to today's talk, I'm going to talk about the Confronting Hegemonic Ideas speaker series. I got funding started off from the Heterodox Academy, and for the first year and for the second year, it took a lot of fandangling and fighting and begging and time and debating, and finally got money for half the series for the second year, and then funding sort of didn't happen. So I'm still looking for an opportunity to kind of restart it, but I'm going to share a little bit about the speaker series, including the second one, which happened. The first one, there will be a publication coming for that, and so I'll spend more time focusing on the second one. With that said, I know the popular term is viewpoint diversity, and that's a great term. I think for myself, I use ideological diversity. It seems to fit better. And for fear of construct proliferation here, I've sort of came up with my own definition. And when I say ideology or ideological diversity in my talk, this is what I'm referring to. And I do borrow from a few places, but this is what I mean. The practice of promoting a range of perspectives, especially socio-political ones, backgrounds, and personal experiences, to answer questions within a broader spirit of intellectual humility, empathy, trust, and curiosity through utilizing respectful debate and constructive disagreement. And so that's ultimately, though, what I was hoping. I'm hoping this speaker series would help. In my field of counseling and psychology, my two fields, there's a strong liberal ideological dominance. 20 to 25% of counselors in one study hold conservative viewpoints. The rest are generally liberal. Another study found that 84% of psychology professors identify as liberal. Another set of studies estimate that if you look on campuses in psychology, the faculty-student ratio of liberals outnumbers conservatives by 15 to 1. Another data study says 95% of social psychologists are liberal on social issues. But in sum, this is not representative of the Canadian population. In the 2025 federal election, approximately 42% of the votes went to the Conservative Party. And these voting behaviors are not limited to individual European descent. Polling estimates had 31% of decided Indigenous and 35% of decided Filipino Canadians voters intending to vote for the Conservative Party. Pre-election polling data also indicated that more than half of the two largest racialized groups in Canada, South Asians and East Asians, supported the Conservative Party of Canada. So overall, this data signifies a divide, and a growing one, between the majority of counselors and psychologists who are still predominantly white, and a notable and growing segment of the population, including racialized and ethnic minoritized individuals. So in sum, the predominant ideological and sociopolitical ideology among counselors and psychologists is not reflective of the general public's political ideology, and the sociopolitical diversity of the population in Canada remains largely unrepresentative in its counselors and psychologists. We have so much evidence, and I'm not going to go through all these points. I'll highlight a couple of them, but psychologists actually admit that they're willing to discriminate against conservatives in publishing, research, hiring, and grant reviews. Conservative students don't basically feel as safe in counseling and psychology programs. Now, the ideological leanings of the therapy professions would not be so much of a concern if it was not for scientific confirmation of their negative impact. So here's some examples. I know that there may not be that many psychologists in the room, but a lot of people have gone to counseling and therapy in their lifetime, and this is sort of some of the impact. Almost half of therapists, and again, this is based on people's awareness. A lot of prejudice discrimination is implicit, goes beyond people's immediate awareness, but this is the numbers are based on people actually are aware of. So I would call them a lower bound of the real number. But about half of therapists admit their socio-political beliefs will moderately or strongly impact how they practice in session. 34% of therapists admit knowing that the client's different political leanings would bias their diagnosis, affect their therapy, and create a real risk of imposing their values. About 60% felt it was appropriate to challenge their client's socio-political values, but they don't believe you should challenge a client's racial values, ethnic values, gender values, sexual orientation values, but their political values or their socio-ideological values were fair game. And, I mean, psychologists and counselors can also commit microaggressions against clients possessing divergent socio-political values or ideologies, such as stereotyping all conservatives as cognitively rigid, authoritarian, racist, or immoral, or even seeing their values as innately wrong. The evidence comes from therapists themselves. And again, I'm not going to have time to read both quotes there. I'll let you just give you a minute to quickly read, or 30 seconds to kind of read those through yourselves. One recent qualitative study, which I cite a lot in my work, demonstrated that students after graduation, that's when they discover that the university education did not prepare them well to discuss issues related to ideological diversity or to actually work or connect with people who are ideologically diverse. While they're in campus, they're generally oblivious to that, but over time, particularly the ones who move out of a big city, realize how unprepared they are to debate, discuss, or even connect with people who are ideologically different. So educators must prepare students to better respond to clients from a broad range of backgrounds. And training programs need to improve their ability to develop culturally competent therapists who can better serve the needs of ideological and politically diverse clients. In fact, in my field, it's not okay to turn a client away due to their gender, due to their sexual orientation, due to their race, due to their ethnicity, but it's okay to turn them away due to their political background, which is ironic. Politics, ideology is not covered in our ethics codes. And so some therapists aren't willing to work with people who are ideologically different. Now, one way that the education programs could integrate ideological diversity into their curriculum is through guest speakers. Guest speakers can provide unique perspectives that would otherwise not be available in standard curriculums, especially for programs with a smaller faculty situated in larger homogeneous communities. So the speaker series had 3 objectives: to increase awareness of research findings and facts, as well as heterodox viewpoints typically ignored or ostracized in counselor and psychology training programs, to model by faculty members intellectual and cultural humility and respectful engagement with speakers who present controversial or unconventional perspectives, and to promote intellectually rigorous research and an improvement in the ability of trainee counselors and psychologists to serve those who differ from them, including with respect to sociopolitical and ideological diversity. So the first speaker is on that YouTube page, so I encourage you to take a look. I have some brief stats there in terms of how many people attended, including how many hits there were on the YouTube pages. About 60% of the attendees were Heterodox Academy members, so I was sort of proud of that. But I was also proud that I was able to reach people who are not HxA members. I think it's easy to preach to the choir, and if I had a talk on campus, I bet you this is the people who would attend, would are more interested in getting those people who are open-minded, who'd be willing to sort of attend and reach them. This was a list of speakers and their topics on the screen there. The most attended ones were the ones on racial justice, for example, by Glenn Lowry, and social justice, psychiatric drugs. On YouTube, the most popular ones are psychiatric drugs, the topic about social justice, and also trigger warnings is quite a popular topic online. Again, there's such a wonderful amount of qualitative open-ended feedback in terms of people's appreciation for the speaker series. All right. The second series, on the screen, there's information about that's the second series. Again, this one took a lot of political fandangling. I think I've made some enemies sort of pushing this forward. Somehow they got funding for a social justice speaker series in about 30 days, and I spent 6 months trying to get funding to get this off the ground. And so there's a little bit of a pushback there. But I was able to get half a series for 1 semester and some funding from my department or faculty for that there. Okay, so there's information about attendance, about the talks. What I found really interesting was there was almost no double attendance. So I was thinking it'd be the same people who attend all the talks, and we actually had very little overlap in terms of who attended the talks. And so I was quite proud that I was actually able to reach 158 unique attendees with the year 2 of the speaker series there. Here were our second set of speakers. I got more engaged with Heterodox Academy, and of course we see some speakers from the Heterodox Academy up here. Dr. Dan Cox, Dr. Sasha Lysova were the first 2 speakers on that second year of the speaker series there. And there are their topics. So overall, it was, I mean, there's not a standardized assessment in a sense of a pure psychological test, but just the general questionnaire feedback was pretty positive. People thought that this was really consistent with the goals of the series, that speakers were knowledgeable, and then they found the talk quite useful there. Just an example of some of the narrative quotes. I found it incredibly useful, both for shattering an unhelpful narrative and also for giving practical alternatives and hope for better policy or practice. But overall, students and faculty and attendees and practitioners really got a lot out of attending these talks in a safe place. And it was quite intentional for me to make the speaker series online because there were some worries about students complaining or shutting down rooms or yelling down rooms, and so we had to intentionally make it an online talk. And it actually opened up to a lot more people who were willing to attend from the safety of their own home when their attendance was anonymous. In conclusion, based on the arguments and research presented above, the therapy profession does not seem like a welcoming place for potential therapists who hold very different socio-political or ideological leanings. There may come a day when counselors and psychologists may face mounting criticism and scrutiny for their lack of ideological diversity and the ideological bubble surrounding the profession. There may come a day when there are louder voices critiquing the hypocrisy involved in stating a commitment to equity, diversity, and inclusion, yet ignoring some large types of diversity. But for now, counselor and psychologist education and training programs in Canada remain ideologically segregated within an ideological bubble, devoid of true ideological diversity, and a speaker series such as the one reported in this talk may be a step towards reconciliation and a step towards preparing more versatile counselors and psychologists with expansive competence capable of serving a wide range of clients in need, not just those they politically or ideologically align with. So definitely, though, my recommendation is that other training programs in counseling and psychology, but also beyond that, have these sort of speaker series. I found when you have them online, you make sure attendance is anonymous, you'll get people who aren't willing to attend. And I know in my teaching experience, it just takes 1 or 2 students in a class who are very vocal about how racist, discriminatory, bigoted some of my readings are for it to shut down the dialogue of other students who actually want to engage. If somebody says, I've had this experience happen, that's a racist reading, no student's going to challenge or want to discuss that reading out loud in class. And to have a speaker series like this, it is going to engage those people and get exposure to people who I think need that exposure, though. So thank you very much.